All right, today we are diving deep into Addison's disease. It's this really fascinating and honestly pretty misunderstood condition where your body's own defense system basically, well, it goes rogue. We're going to look at the signs, the science, and what the future holds.
So, imagine this. You're just exhausted all the time. You have this weird, intense craving for salty foods, and you notice your skin is getting darker even though you haven't been in the sun. What could that possibly be? Well, these are the clues that start to form the puzzle of Addison's disease.
The path to getting a diagnosis, it usually starts with a bunch of these really mysterious symptoms that are just incredibly easy to brush off or mistake for something else entirely.
So you've got the fatigue, the weight loss, that darkening skin we mentioned, and that really intense craving for salt. I mean, on their own, any one of these could just be chalked up to stress or maybe even depression. But when you put them all together, they start painting a pretty specific picture of Addison's. And because these symptoms just kind of creep up on you so slowly, getting a diagnosis often takes a long time. Get this. A full 40% of people live with these signs for over 6 months before they finally get an answer. Can you just imagine how that feels? Feeling sick for that long? Maybe even being told it's all in your head? This kind of delay isn't just frustrating, it can be really, really dangerous.
So what is actually going on inside the body to cause all this chaos? Well, we're about to uncover the culprit, and it's a classic case of mistaken identity by your own body.
At its core, Addison's disease is an autoimmune condition. Now, what that means is your own immune system, the thing that's supposed to protect you, makes a mistake. It identifies the outer layer of your adrenal glands as an enemy and just starts attacking it. It's basically friendly fire on a really critical part of your internal hardware.
So this here shows us ground zero for the problem. There's little adrenal glands that sit right on top of your kidneys. When they're being destroyed, they can't make two absolutely crucial hormones anymore. And that shutdown triggers this massive domino effect all through your body, which is what creates all those symptoms we just talked about.
Let's break that down, right? On one side, you have cortisol. Think of it as your body's built-in stress manager. You take away cortisol, you get that crushing fatigue. Then, on the other side, you have mineralocorticoids. Their job is to manage your salt and water balance. Without them, your body just can't hold on to sodium, and that's what triggers those super intense salt cravings. Okay, and this brings us to the most serious part of this whole story. When that hormone deficiency gets really bad, often because of that diagnostic delay we were just talking about, it can lead to a life-threatening emergency. It's called an adrenal crisis. And here is a number that is just, it's staggering. Up to half, that's 50%, of all people with Addison's disease are only diagnosed for the very first time during one of these adrenal crises. That means their first hello to this condition is a full-blown lights and sirens medical emergency. So what is an adrenal crisis? It's a state of extreme critical cortisol deficiency. The number one feature is a severe, life-threatening drop in blood pressure. And it's often set off by something your body could normally handle just fine, like a simple infection. But without cortisol to manage the stress of that infection, the whole system just collapses. And this is why these steroid emergency cards are so incredibly vital. People with Addison's have to carry these so that if something happens, first responders know immediately that they are physically dependent on daily steroid medication. In an emergency, this card literally speaks for them, making sure they get the life-saving hydrocortisone they need right away. Okay, so after all that pretty scary stuff, here's the good news. The really good news is that once it's identified, Addison's disease has gone from being a fatal illness to a totally manageable condition. So how do doctors finally pin it down, and what does life look like after that? The process to figure it out is actually pretty logical. It all starts with the doctor suspecting something based on the symptoms. Then they measure cortisol and another hormone called ACTH. And here's the dead giveaway. In Addison's, your cortisol is super low, but your ACTH is sky high. It's like your brain is screaming at your adrenal glands to get to work, but the glands just can't respond. A final antibody test can then confirm that an autoimmune attack is the reason why. So the treatment itself is lifelong hormone replacement. It's really that straightforward. Patients take pills every single day to give their body back the hormones that their adrenal glands can't make anymore. This simple idea has completely changed the game for this disease. But, getting a diagnosis and a prescription, that's just the beginning. It's not a perfect fix, because just taking pills doesn't quite replicate what the body does so elegantly on its own. Living with Addison's means dealing with a whole unique set of daily challenges. So take a look at this first graph. This is what cortisol release is supposed to look like in a healthy person. See that? It's a smooth, elegant curve. It rises in the morning to help you wake up, and then it gently tapers off during the day. That's the body's natural rhythm.
Now, let's look at the reality of treatment. Look at those sharp peaks and those deep valleys. That's what happens when you take hydrocortisone pills a few times a day. It's less of a smooth curve and more of a hormonal roller coaster. And that mismatch is probably why so many people with Addison's still fight with fatigue. And of course, life itself is not a smooth curve, right? This is where something called stress dosing comes in. Patients basically have to learn to be their own adrenal glands. If they get a fever, they have to double or even triple their medication. If they're facing major stress, they need an extra dose. It's a constant job of self-monitoring and management. This constant management is a huge, huge burden. But science is on the case. So let's wrap this up by looking at the very real hope that's on the horizon for treating Addison's disease. There are some really exciting things in the works. We have modified release drugs that are already out there, trying to smooth out that cortisol curve. But looking even further down the road, researchers are exploring cell replacement and regenerative therapies. We're talking about actually transplanting new adrenal cells or trying to wake up any that might be left. And this quote from the research really captures the new way of thinking perfectly. The goal isn't just about better replacement therapy anymore, it's about restoration. There is real optimism in the scientific world that one day we could actually get the body to start making its own cortisol again. You know, we've already transformed a fatal illness into one people can live with. But that next giant leap feels like it's just around the corner. Could science one day literally restart a person's own hormone factory? That's the question that's driving the next wave of research, and it leaves us with an awful lot to be hopeful for.